Okay, so next for pre-participation health screening, we have the question that does the individual currently exercise regularly? If the answer is no, and then we proceed with the question, does she or he have any severe metabolic or renal disease or any sign and symptom that suggests that she or he does? If yes, it is recommended for us to do medical clearance, and if no, the medical clearance are not necessary. We can proceed to light to moderate intensity exercise recommended, and then we may gradually progress as tolerated to vigorous exercise by following the guideline from the ACSM. And then if the answer to the question is yes, which is does and then we proceed with does she or he have any CV, metabolic or renal disease or any sign or symptom? If the answer is no, we doesn't need to do any medical clearance to continue moderate or vigorous exercise, which may progress as tolerated following the SSM guidelines. And if she or he have the stated diseases, we proceed with does she or he have known but asymptomatic of that disease? If yes, we still doesn't need to do any medical clearance to continue. We can still progress gradually to vigorous exercise. If there is no change in symptom and medical clearance has been obtained in the last 12 months. If she does not know or about her condition or his condition, we proceed with does she or he have any sign or symptoms suggestive of that diseases? If yes, we must to discontinue or terminate the exercise and we seek for medical clearance. And if not, there is no need for us to do medical clearance. We can still continue with moderate or vigorous exercise, which may progress as tolerated following the SSM guidelines. Okay, next.
Okay, next. This is the example of pre-participation questionnaire that modified from ACSM. So this questionnaire is firstly they will ask for the history of the participants of health uh, history, and then the second part will ask for the cardiovascular risk factor. For this history part, firstly the questionnaire will ask for the cardiovascular history. Did the participant have heart attack, heart surgery, or any cardiovascular condition? And then we will ask for the symptoms. The symptoms that related to the cardiovascular condition, and then other health issues such as diabetes, asthma, or musculoskeletal problems. So if the participants are having any of these problem, need to undergo for the medical clearance first. And then for the cardiovascular risk factors, uh, if the participant have any two or more of these conditions, need to undergo medical clearance before and cannot be allowed to perform the exercise. And last part, if the participant didn't have any of this problem, participants can continue with performing exercise. We, okay, that's all.
Doctor, we have finished our presentation.
Okay. Regarding exercise and physical activity pre-participation health screening, okay, this group actually they mix up sports participations and apa ni, exercise and physical activity. Betul tak? The first half tu sounds like sports participation. Okay, alright, okay. So we are going to focus on health exercise and physical activity pre-participation screening, because that is what we do. Okay, most of the time our major role is to prescribe exercise basically for healthy populations and also patients with clinical conditions, and also we prescribe exercise for maintaining our health, preventions of disease. All right. So if I can, most your references that you referred to before 2015 is actually no more apa ni not applicable to me. All right. Okay. Can you show me the slide on the flowchart? Flowchart by SCSM. Can you show again the flowchart by SCSM on the apa ni pathways to screening? Okay. Can you enlarge? All right. This one. Okay. So all right. Just to remind everyone, we as exercise professionals or physiotherapists, okay, prior to, especially if you are working for a private setting, or if you are beginning to prescribe exercises to your clients, the first thing to do is to use this model. Okay, all right, use this model. All right, or you can use the PAQ plus. PAQ plus. Okay, so PAQ plus, probably next week we will try to have some time to look at the PAQ plus. Okay, those if you want to do research, okay, and your research involves physical testing or exercises, interventions, okay, you have to have that in your protocol of your research methodology. You must include the PAQ plus, okay. PAQ means physical activity readiness questionnaire. That is one of the component of health screening. Okay, plus means plus lah, plus. They have updated. Bila recently, I don't remember the date. Okay, so this one, the pre-participation health screening, okay, updated for 2015 and beyond. So the SCSM one, the old one is why they update? Okay, why they update this model? Because they found that previously the screening was too bukan difficult, you know, but too tedious and too strict. Okay, and because SCSM was vetoed lah, you know, because American kan, so dekat America if you want to prescribe exercise, by right, you have to have that screening first. Okay, tetapi because one of the component of the screening is to refer to a physician. Okay, so bila refer to a physician, even if you have a certain symptom, it is what, costly, mahal. You know, you kena bayar and ambil masa. So they found that based on the finding, research and follow up, the screening becomes a barrier to exercise participation. Faham tak? So, faham tak maksud saya? So they found that this screening sebenarnya buang masa and it's costly. Menyebabkan they don't want to do the exercises because they have to go for screening prior to getting being cleared, okay, being cleared from any medical condition, then only they can start doing exercises. What nonsense kan? Betul tak? Banyak sangat macam you mentioned just now, kena buat ni lah, apalah semua. It's a waste of time and it's time consuming. It's costly for some majority of the American, So they have updated. So they updated the health screening, pre-participation health screening. So this is much easier, simpler, cost effective. Alright? Ataupun you guna the PAQ Plus. So ada dua lah questionnaire. For questionnaire tu you guna PAQ Plus ataupun kalau Australia they are slightly different. They don't really follow, they adapt the SASM. Okay, kalau siapa nak baca carilah paper yang I mentioned just now, right? Okay, now let's look at this. Okay, for instance, now you are seeing or you want to recommend exercise or you want to do some physical testing. Okay, especially yang nak buat research yang banyak buat physical testing. Okay. Alright, so how do you start? Check. Okay, does the individual are you currently doing any exercises regularly? No, I don't do any exercises. Okay, do you have any cardiovascular, metabolic or renal disease or sign or symptoms that suggest that you probably have some knee contraindication? If yes, then they have to go for medical clearance. Okay, so kenalah jumpa physician. If no, okay, no symptoms of cardiovascular, no medical clearance necessary, light to moderate intensity, exercise recommended. May gradually progress as tolerated to vigorous exercise following SCSM guidelines. Okay, so as simple as that. Tak ada sakit apa regardless of age ke apa, then startlah buat exercise. Tak perlulah you undergo everything, right? Okay, you don't have to go. Okay, does the individual currently exercise regularly? Yes, I'm doing exercise regularly. Tapi why are you coming seeing me? Mungkin dia nak more systematic exercises kot, kan? So does he or she have cardiovascular, metabolic or renal disease or signs or symptoms that suggest he or he has some of these disease? If no medical clearance necessary to continue moderate or vigorous exercise which may progress as tolerated according to following the SSM guidelines for the exercise recommendation. If you have been doing exercises regularly, but somehow you do have cardiovascular or metabolic or renal disease. Remember these three, cardiovascular, metabolic, example metabolic like ni lah, cholesterol, apa lagi? High cholesterol, diabetes, and then renal disease, okay? Yes, okay? Do you have does she or he have known but asymptomatic cardiovascular, metabolic or renal disease? Okay, kalau does she have known but asymptomatic? Okay, dia tahu tapi tak ada symptom, right?